and all. Today I will be presenting a short case on case report, that is ALHE, angiolymphoid hyperplasia with eosinophilia, presenting at an atypical site with lymphadenopathy. So it's a overlapping feature with the Kimura disease. So under the introduction, ALHE is an uncommon benign tumor, that is vascular component will be there, was initially thought to be a late stage of the Kimura's disease, but later it was considered as a separate entity, which may coexist with the Kimura disease. So here we present a case ALHE with anemia and diabetes. So anemia is hemoglobin was 10.6 and blood sugar level was 178, that is RBS. So these associations have not been previously published or noted. So our patient also had lymphadenopathy, which was a feature of the Kimura disease, post-auricular lymphadenopathy. So the case description, a 34-year-old male patient, woodcutter by profession, presented with itchy, multiple skin colored to the reddish colored lesions present over the lower lip area and the chin area. Under the examination, it revealed multiple soft and firm, smooth and shiny erythematous papules, nodules, and a few hemorrhagic bleeds when touched with crusting and varying in sizes from 0.5 centimeter to the 1.5 centimeter, present over the lower lip area and the chin area with few excoriation marks. There was an association of regional lymphadenopathy, posterior auricular lymph nodes were involved, known case of diabetes mellitus for 6 years. Under the laboratory reports, hemoglobin found to be 10.6 gram percentage, eosinophil count was 17.3, sugar levels was 178 milligram percentage, HbA1c was 6.2, ESR was 132 mmHg, HCV and other serology reports like HCV, HbSAg, VDRL came negative, and path stain was negative to see the mycetoma was present or not, any fungal element. Histopathologically, it revealed increased thick-walled capillaries and venules in the upper dermis area, surrounded by the infiltrates of the lymphocytes and eosinophils with mild edema and proliferating fibroblasts. Patient was admitted under the plastic surgery department for the excision of the lesion, which later he got operated. Discussion part is okay. So this was the clinical image. As you can see, it's a multiple firm erythematous nodules, papules were present all over the chin area and the lower lip area. You can see the bleeding points were also been there, and crust was also there. So this area whole, actually I'm not having the post-op pictures, but this full area got treated and patient got relieved of this. But this like 6 or 7 months before picture. So we have to take the picture for after post-op also later. And this is the histopathological image. Here you can clearly see the lots of the eosinophils are there. So under the discussion part, ALHE was described by the Wells and Webster in 1969, which was considered to be a later stage of the Kimura disease. And one more thing, immunohistochemical markers were CD31 and 34 also being present. So it is a conclusive for the ALHE. The condition present with the erythematous skin-colored dome-shaped dermal papules and nodules, often associated with the spontaneous bleeding, pain, pulsation, pruritus, and growth, and frequent presence of the mural damage or rupture in intralesional large vessels of ALHE, was suggested a role of trauma and AV shunting in its pathogenesis. So one thing we should note about this ALHE is it may not be a separate entity for the Kimura disease, but many features are overlapping. So still we cannot say it's a Kimura or ALHE. Both are like similar features only. It's there. So in this case, we have found that it was associated with the uncontrolled blood sugar levels and with anemia. Previously, this type of case was not presented in any reports. So this is the only thing I found new in this. This much only one. It's a very short.
Thank you for that presentation. Did you have to?
Thank you.